Hi guys, in this video we discuss about monoclonal antibodies. In last 2 to 3 years, there are minimum 2 to 3 questions in every exam, both in NEET and INICET. So this topic is very important. First we are going to discuss about nomenclature in very short, then the important examples. In 70 to 80% cases, the hints are hidden within the name itself. If the monoclonal antibody contains XI, means they are chimeric, means 65% are from human source. If the monoclonal antibody contains ZU, means they are humanized, means 95% source are human. If the monoclonal antibody contains U, then source is human and it is 100% human. And if the source is O, means it is arrived from urine, means 0% human. So we can assume the source from the name itself. Now nomenclature. At the end there should be MAP, and before MAP the alphabet contains source, and before source the alphabet contains use. So you can get a rough idea about the monoclonal antibody from the name itself, like trastuzumab, used in HER2 positive breast cancer. MAP, इसका पहले है ZU, means it is humanized. इसका पहले है TU, means it is used for any tumor, TU for tumor, breast cancer. Now rituximab, MAP, इसका पहले XI, means it is chimeric. XI के पहले TU, means it is also used for tumor. Which tumor? CLL. There are so many use of rituximab, we discuss later on. Dinutuximab, XI means chimeric, TU means used for any tumor. इसका पहले NU. If the monoclonal antibody contains NU or NE, means the monoclonal antibody used for any neural component. NU or NE, used for any neural component, means it is used for any neural tumor. Dinutuximab used for neuroblastoma. Okay. Now some important example. There are so many examples of monoclonal antibody. We now discuss about the very important one which you cannot skip. First rituximab, very famous one, antibody against CD20. Now the uses: CLL, ITP, TTP, multiple sclerosis, rheumatoid arthritis. How to remember? R for rheumatoid arthritis, I for ITP, T for TTP, RA, TTP, ITP. And remember the CLL, no mnemonics. By the way, you have to remember this one. This is very important. Now ocrelizumab. This is previous year question. Ocrelizumab. Ocrelizumab is also antibody against CD20. It is used for primary progressive multiple sclerosis and rheumatoid arthritis. Okay. How to remember? O. CD20. O. Easy. Now dupilumab, antibody against interleukin 4, used for atopic dermatitis, bronchial asthma. D, fourth letter, so interleukin 4. Okay. Basiliximab, B, second letter, interleukin 2, CD25. It is used for prophylaxis of acute graft rejection. Alemtuzumab, it is monoclonal antibody against CD52. It is used for large cell lymphoma and multiple sclerosis. Alemtuzumab, L for large cell lymphoma, M for multiple sclerosis. Okay. Now abciximab, everyone knows it is antibody against GP2B3A, and its function is it inhibits platelet aggregation. Now what is platelet aggregation we can discuss in very short. Suppose this is the blood vessel. This is the blood vessel. Injury happens here, so collagen exposed. Now platelet has GP1B9. This receptor can attach with von Willebrand factor which is present in endothelium. Von Willebrand factor present in endothelium. Glycoprotein 1b9 present in platelet. So this process is called adhesion. Now one platelet attaches with another platelet by the help of glycoprotein 2b3A receptor and also ADP. If the adhesion process is deranged, means glycoprotein 1b9 is defective, what disease will happen? Barnard-Solier. If the glycoprotein 2b3A is defective, what disease will happen? Glanzmann thrombasthenia. Okay. If glycoprotein 1b9 is defective, then Barnard-Solier syndrome. If glycoprotein 2b3 is defective, then Glanzmann thrombasthenia is happen. Now we discuss about some immune checkpoint inhibitors. This is T lymphocyte. Okay, this is T lymphocyte, and this is antigen presenting cell. Antigen presenting cell has PDL ligand, programmed death cell ligand, and CD8086. It is also a ligand. And T lymphocyte has PD1 receptor and CTLA4 receptor. PDL1 attaches with PD1 receptor. CD8086 ligand attaches with CTLA4 receptor. Now, if this arrangement is happen, then it is a protective mechanism. Means if antigen presenting cell presents body's own cell, then T lymphocyte does not destroy the APC. This is clear, na? If APC presents body's own cell, T lymphocyte does not destroy the APC. But if this arrangement is not happen, or antigen presenting cell contains the foreign antigen, then T lymphocyte can destroy it. So this is a protective mechanism. Now cancer cell can produce increased amount of PDL ligand and CTLA4 ligand. Cancer cell produce increased amount of PDL ligand, CTLA4 ligand, means CD8086. So they can evade the immune system. Okay. Now if we develop any drug against PD1 ligand or PD1 receptor, then what happens? This arrangement will not happen. Or any drug against CTLA4 receptor, this arrangement will not happen. Now T lymphocyte can destroy the APC. So cancer cell will destroy it. Okay. So this is the mechanism of pembrolizumab, nivolumab. These are the drugs against PD1 receptor. And the use is endometrial carcinoma, melanoma, urothelial carcinoma, lung cancer, Hodgkin lymphoma, non-Hodgkin lymphoma. This is the previous year question. Now atezolizumab, this is the monoclonal antibody against PD1 ligand. Atezolizumab is used for non-small cell lung carcinoma, breast carcinoma, bladder carcinoma. And there are some drugs which blocks the CTLA4 receptor. This CTLA4. The drugs are tremelimumab, ipilimumab. Use is malignant melanoma. Premeli M, ipilimumab M. M for malignant melanoma. Easy. Cetuximab, monoclonal antibody against EGFR. This is very famous one. Uses head neck cancer, colon carcinoma, menetrier disease. Cetuximab is used in menetrier disease also. Okay. Now trastuzumab. These are the monoclonal antibody against HER2 receptor, and the use is HER2 positive breast carcinoma. Everyone knows. Bevacizumab, monoclonal antibody against VEGF, vascular endothelial growth factor inhibitor, used in diabetic retinopathy and age-related macular degeneration. Bevacizumab, MAP for monoclonal antibody. Zu means humanized. CI means circulation. CI for circulation. And VA for vascular. That's how we can remember it. Denosumab. These are the monoclonal antibody against rank ligand, and this is used in osteoporosis. A short discussion about rank ligand. When PTH, parathyroid hormone, stimulates the osteoblast, then osteoblast express rank ligand and secrete osteoprotein. Okay, when parathyroid hormone stimulates osteoblast, osteoblast express rank ligand and secretes osteoprotein. Rank ligand binds with rank receptor which is present in osteoclast. Rank ligand present in osteoblast, rank receptor present in osteoclast. Now, this rank ligand and rank receptor stimulates osteoclast. Okay, but osteoprotein inhibits rank ligand. Now, what happens? If osteoblast express rank ligand and it stimulates osteoclast, means bone resorption can happen. But if osteoprotein is activated, then it inhibits the rank ligand and it inhibits the osteoclast, means it inhibits the bone resorption. Now, denosumab inhibits the rank ligand. Denosumab inhibits the rank ligand. So it inhibits the osteoclast, means it inhibits the bone resorption. So it is used in osteoporosis. Estrogen stimulates the osteoprotein. Estrogen. So it inhibits the rank ligand, it inhibits the osteoclast, means bone resorption is inhibited. That's why estrogen is protective in osteoporosis. Now, tildrakizumab. This is used in chronic plaque psoriasis. Mechanism is interleukin 23 inhibitor. T for 2, T for 3. IL-23, 2, 3. T for 2, T for 3, IL-23. Easy. Now, aducanumab. MAB means monoclonal antibody. ANU means neural component. A means Alzheimer. That's how we can remember it. It is a monoclonal antibody against A beta amyloid. So it is used in Alzheimer's disease. Okay. So a quick recap. At first, source. XI means chimeric, ZU means humanized, U means human, O means murine. Now the nomenclature. MAB. Immediately before the MAB, there is source. Immediately before the source, there is use. Trastuzumab, rituximab against CD20. Use CLL, ITP, TTP, multiple sclerosis, rheumatoid arthritis. Ocrelizumab against CD20, used in primary progressive multiple sclerosis, rheumatoid arthritis. Dupilumab against interleukin 4, used in atopic dermatitis, bronchial asthma. Basiliximab, interleukin 2 inhibitor or CD25 inhibitor, used in prophylaxis of acute graft rejection. Alemtuzumab, CD52 inhibitor, used in large cell lymphoma, multiple sclerosis. Abciximab against glycoprotein 2B3A, used in prophylaxis of AMI. It inhibits platelet aggregation. Now, pembrolizumab, nivolumab against PD-1 receptor, used in endometrial carcinoma, melanoma, urothelial carcinoma, lung carcinoma, Hodgkin lymphoma, non-Hodgkin lymphoma. Atezolizumab against PD-1 ligand, used in non-small cell carcinoma, breast carcinoma, bladder carcinoma. Tremelimumab against CTLA4, used in malignant melanoma. Cetuximab, EGFR inhibitor, used in head neck cancer, colon cancer, meningeal disease. Trastuzumab, HER2 inhibitor, used in HER2 positive breast cancer. Bevacizumab, VEGF inhibitor, used in diabetic retinopathy, age-related macular degeneration. Denosumab, rank ligand inhibitor, used in osteoporosis. Tildrakizumab, interleukin 23 inhibitor, used in chronic plaque psoriasis. Aducanumab, A beta amyloid inhibitor, used in Alzheimer's disease. So these are some important points about monoclonal antibodies. Revise this topic frequently because these are very much volatile. Frequently revise it. See you in next video, and if you like this video, please like, comment, share and subscribe.